Hello everybody, welcome to number 1 Doctor channel. Today we will talk about causes of fresh bleeding per rectum. The passage of bright red blood per rectum is a common symptom, which the patient usually attributes to piles. Indeed, hemorrhoids are by far the most common cause of rectal bleeding. It is important, however, to bear in mind a list of possible causes of this symptom. General causes: bleeding diatheses, rare. Local causes: hemorrhoids, fissure and ano. Tumors of the colon and rectum, benign, malignant. Diverticular disease, ulcerative colitis. Trauma, angiodysplasia of the colon. Rarely, massive hemorrhage from higher up the alimentary canal. Even a bleeding duodenal ulcer may produce bright red blood per rectum instead of the usual melena, although such cases are commonly accompanied by hematemesis. Thanks for watching. Please like and share our videos and subscribe to our YouTube channel number 1 Doctor. With my best wishes, Dr. 8 Fahmed.